welcome back to my podcast, guys. Today we are talking about, I don't know if I should wear these whilst doing the podcast. Hello! Whoa. Okay, that's enough of that. I feel like it's quite a serious topic, so maybe having the googly eyes isn't a good idea. So, bullying in medicine. Bullying in healthcare places. I've been bullied, I've seen it, and I also question, having reflected on all of, this podcast episode, have I also been a bully myself? And today we're answering all of those questions. Surprisingly, and I say surprisingly because I am amazed at how common bullying is in the healthcare environment. You think, oh, we're nice and caring, but no, we're all fucking horrible apparently, because by the time somebody is a consultant or more senior anyway, 80% of them will have experienced bullying to themselves in their career. And that extends to 46% of students. So it obviously mostly happens in your student years. And today we're going to be exploring why. Also, we're going to be covering if you're being bullied, what to do about it, and how do you know if you're a bully? We're going to be talking about some stories of, some situations that I've seen or been involved in, and we're just going to be having a good time. So if you're being bullied, or if you're just interested, then strap up, people, because hello, welcome back to my podcast. I'm Dawn, I am a doctor, and I cover all things doctory, self-improvement, all the nitty-gritty stuff, not the sciencey stuff, like the kind of relationship, mental healthy side. So if you're interested in that, if you're a doctor, medical student, nurse, or just, not part of the medical profession, that's fine. That's all cool with me. Come join. So yeah, welcome. Hi. Let's talk about what bullying is. And I am specifically talking about healthcare bullying here because, that's kind of my jam. So what would you see if you were involved or, involved in any way, whether you are the bully or whether you are being bullied or whether you're observing it? Gossip apparently is a form of bullying. So I get it. It is like talking behind people's back, not a great idea. But it happens so commonly that, especially just in normal life, that I kind of didn't even think of that one as a bullying thing. Like, it's probably, I just feel like humans love to gossip. Okay, the next one is one that I'm like, this one is one that I've seen a lot, and that is humiliation. Now, I'll be getting into some more, the real depths of it, but I'm just going through the points here very quickly. The next one is fear, and I think that comes kind of hand in hand with intimidation. And another one that is, quite dangerous in medicine is feeling the pressure to do things that you don't feel qualified to do. And I've actually put that you don't want to do, but aren't there a lot of things in medicine that we don't want to do? But it's like, okay, there are some things you don't want to do, but when I was a third year or something, I didn't want to talk to patients. They terrified me. So in front of other people. So, if I just never did what I didn't want to do, then I would not get anywhere. But it's doing things that you don't feel, you're not qualified to do, or you're not, being unsupervised or whatever. And that's just really dangerous, and I have had situations where it's been like, can you go and do this on your own? And to be honest, I've been like, no, maybe I'm just good at standing up for myself, but I'm also like, I don't think I'm allowed to do that. For example, signing consent. I think, if I'm not really doing the procedure, firstly, if I don't even know how to do it, or also if it's not me doing it, if it were me doing a procedure to the patient, I would want to know that I had consented them myself, or at least someone that I know and trust to have done it right has done it. I wouldn't just be like, it's the F1, can you go and do it? No, that's a big deal, I feel. So being pressured into doing things that you don't feel qualified to do, I do feel like that's more common in busy times. I don't know, I just feel like I can say no to that one. I guess I didn't cover what is bullying. Okay, I wanted to get a proper definition for this. So bullying is a form of aggressive behaviour. It doesn't have to be physically aggressive, but it can be verbally aggressive or passive aggressive or mildly aggressive that involves repeated, usually it's not not just like one event. Intentional. Yeah, okay. Well, that's an interesting part there. Intentional, okay? Because we're going to get onto that a little bit later. Intentional harm inflicted by one individual or a group of individuals towards another person who may be perceived as weaker or vulnerable. Usually occurs in social settings, because what you'll find interesting is if you're with a bully on their own, they don't bully you. Very interesting, isn't it? And it can take various forms, such as, like I said, physical, verbal, social. I don't really know what that means. Social involves manipulating relationships, spreading rumours, excluding someone from the group, or embarrassing them in public. Or cyberbullying, more common, obviously, over the last 20-30 years. So verbal bullying. I don't think physical bullying is very common in healthcare. I hope not anyway. I've never seen physical bullying, as in like physical bullying is hitting, pushing, damaging someone's property. Well, I guess that might have happened, but not that I've seen. So I feel like it's more verbal and social. So verbal is using hurtful words, insults, name calling, spreading rumours to demean or humiliate the person, and we already talked about social. I feel like maybe cyberbullying is not something I've ever witnessed, but like I don't actually spend any, I spend no time on social media. Like I know that I put content out, but I don't scroll. I'm not a scroller. I'm also not like a poster as such. As in like posting, like I do post, but as in socially post, right? Not, it's more about my content. I think my eyes are really itchy. I'm very sorry about that. So why do people bully? Why? Interestingly, I read something that had been researched, it was like factually informative, and it said that bullies are apparently attracted to caring professions, which I find very concerning. Like, someone said to me fairly recently, within the last couple of months, they're not in the healthcare profession, but they said, I don't want to say all, a lot of nurses because we were talking about some people we went to school with and how they were bullies, and then I said, I can't believe they went into nursing, right? They became nurses, and the person I was speaking with was like, are you surprised? And I was like, yeah, like, you're going into a caring profession. It doesn't make any sense. And I've said it now, this person said a lot of nurses are bitches. And I was like, not something I'd considered before. I think I'm quite good at like standing up for myself, and I'm quite confident. So, especially with age, like as a student, maybe it was easier to bully me, but not much phases me, and if it does, often doesn't show. So I'm going to be talking about some situations where I have been bullied, and yeah, that was interestingly only short term, I think, because it's like, I don't know, if a cat is playing with a mouse and the mouse plays dead, like, it's not that exciting anymore, is it? So if the mouse is just like, meh, I'm not bothered, like, leave me alone, then the cat just gets a bit bored and is like, no, I want someone who fights back, right? So, weird analogy, but I guess it kind of works. So bullies are more attracted to caring professions because they have higher opportunity to exercise power and control over vulnerable people, not just patients, which is kind of troubling, right? But also because it's so hierarchical. I need to put this pen down because I'm such a pen clicker. I'm like, click, 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 click. You don't want to hear that. I'm sorry. So not just patients, in fact, oh god, this is really opening up some concerning features for me, some concerning thoughts, because I'm like, maybe people are bullying patients, like in terms of telling them what to do, or telling them that their symptoms aren't, like, I don't know. No one's ever like said, oh, your symptoms aren't important enough, but it's that kind of vibe, right? You get a feeling. So anyway, people who are more vulnerable, and we have a hierarchical system, so in theory, if you go in as a doctor or as a nurse, then you work your way up the ranks, and then you have the ability to bully people who are below you. And also you have students. Now, I'm not saying like oh yeah, go into the caring profession so you can bully people. Like, I just can't believe that is the case. And I don't think it's a conscious thought. I don't think people are like, yeah, I'm a bully, so I'm gonna go and become a nurse or a doctor. But it's I would say it's like not that surprising when I really think about it. Strange. Okay, this is really opening some doors for me. So if it's opening some mental doors for me, I'm sure it's doing something for you too. Why do people bully? Doctors, nurses, healthcare people in particular. So I think a lot of it is, yeah, like I said, if you notice, a lot of bullying goes on in front of other people. It's usually not like in the changing room, behind closed doors, or like when you're just one-on-one with that person. Although it might carry on, I suppose, like ignoring someone, not really paying them any attention, not being very nice. Like, you know, you're sitting in the lunchroom and they come in and then you leave. I guess that could happen. But I think a lot of bullies feel inferior and feel, you know, they have a kind of jealousy and envy, and they want to feel better about themselves, so they put other people down. Another thing that's really common, I would say, in just humans, but in particular in healthcare, is the cycle of, I'm going to call it abuse, right? Cycle of bullying, cycle of abuse is very common because a lot of our seniors or their seniors will have been taught by humiliation, will have been bullied, so they are then more likely to treat the people who are below them, more junior to them, with the same treatment, and then the cycle continues. Now, I'm just thinking this, and I'm like, God, I hope this doesn't happen to me. But yeah, I also think bullying, gossiping, like I do love to gossip. Like, it makes me feel good. I don't know if it's because I feel socially connected to other people, or whether it's because, I don't know, just makes you feel good. I don't know. But it's not something I like about myself. In fact, I very much try to stop it. But it does have this, like, I guess it feels like a kind of dopamine release. Like, you're like, ooh, that felt good, you know? Like a instant gratification. I also think some people just don't realise. Okay. I don't know. I'm reluctant to say this because I'm like, can you ever not realise that you're bullying? I feel like maybe you can not realise, but that's because you're just so oblivious of what's going on, or is it because no one's ever told you? Or is it because ignorance is bliss? Or is it because you don't want to accept that is you? Or is it because the person that you're bullying is like staying quiet, and you're so, like, you know, wrapped up in your own group that you know, if your type of bullying is like excluding people, then if you're excluding them, then you don't know that you're doing it as such. But then I also think, like, I don't know, maybe that's just not being a nice person. It's a really tricky one. Is it acceptable to bully if you don't realise you're doing it? But is it even possible to bully and not even like have an idea whatsoever? Like, are you just always completely oblivious to it? That is my question for you. Like, answer it down below. I feel like you're always gonna know, but then maybe you just don't care, or maybe you're ignoring the signs. Interesting. Yeah, if you're listening on YouTube, like, yeah, give it a like. If you're listening on the podcast, just the audio, you can go over to my YouTubes and give it a little comment, or I don't know, send me a message on Instagram or Facebook or whatever. I've changed it to @DawnBarlow30 because I stopped identifying as a doctor for a bit, so I thought I'm gonna take Diaries of a Doctor away, and I don't know, 30 is a bit weird, but like, that's what my TikTok is, and I just thought no one's gonna have it, so I'm 30, right? I should have gone for something that was more pertinent to myself, you know, like Dawn Barlow 94, right? But no, 30 was assigned to me, and I rolled with it. Interestingly, there's another point about bullies, is that often they'll bully someone who they think is more clever than them, better achieving, because they feel inferior, and they don't want to feel inferior, because who does, right? And you then bully bully that person to make them feel shit about themselves because they might be cleverer than you or scored better in a test than you, and it just makes you feel more superior. It makes you feel better as a result. So let's talk about my experiences as a medical student. I think this is the most common place that you're going to get bullied in the healthcare profession, is as a student. Oh boy, were there a lot of tears shed by medical students, and I'm sure other students? Yes, significant amounts of tears were shed from consultants, dealing with consultants. And it's because we're easy targets, right? I'm not just talking about medical students, I'm talking about like any kind of student, okay? The thing is, they're doing your assessments, they're signing you off for things. They've got some kind of, well, they have got superiority over you, but they kind of decide your future a little bit. And also they decide if you pass your exams, and they decide, you know, there's a lot of control from seniors, whether it's explicit or implicit or just implied, or you know, you don't have to be actually saying it, but it's like a known thing, right? So I don't think I ever cried from a consultant, but I've seen it happen with other students. And the main thing is fucking teaching by humiliation. And you think, oh, we'd be outdated with that by now, but no, we're still going with that one. So if you're not aware of what teaching by humiliation is, aren't you fucking lucky? Because basically it's not like somebody sat down and designed it. I'm going to use that word anyway because I can't think of another one. It's designed to make you feel shit, and to make the person who's humiliating you feel good, right? Make them feel like they know way more than you, which they do anyway. Like, you don't need to rub it in, okay? But I think it comes from a place of, I was taught like this, so I will also teach you like this. But maybe they don't realise that they're doing it. Maybe because they've been taught that themselves, maybe they're just like, well, this is what I was taught like, so this is how I'm going to do it. Like, and also, I think there is some kind of frustration with when you're a specialist teaching a medical student. If you don't really have, you know, if you've been qualified for like 30 years, you lose sight of the fact that medical students know nothing, okay? And that is not me bullying medical students. That is me saying, as a medical student, did I know anything? Not really. Like, I learned all the medical stuff, but I didn't know, like, you know, specific, like, what is the dose of bisoprolol in post-MI patients? Like, I don't fucking know. Like, maybe that's a more obvious one, but what's the mechanism of I'm trying to think of something that I wouldn't have known as a medical student, or like would have been like maybe anatomy. They used to grill us, right? And yeah, we were technically from a medical student with a medical school who was not well known for knowing its anatomy, but it's also like, is it, you know, am I really gonna know about that bloody groove that this tiny artery goes through? And like, no, I'm not gonna know what that groove is called. I'm sorry. But I think there are quite unreasonable expectations from consultants who are highly specialised and who have been specialised for a while, and they're like, well, why don't you know everything about my specialty? And it's like, oh, okay, sorry. Firstly, I'm 19, and secondly, I don't care. No, I'm joking. Secondly, I have been doing this for like a year, like maybe not even that. Thirdly, I've got about 20 specialties to learn, and you've got one, and you've been doing it for 30 years, and you do it every day. So get the fuck off my back, okay? Like, chill out. And there was constantly that feeling of like, you know, why don't you know this? Like, them being like, why don't you know this? I can't believe you don't know this. Do they even teach you medicine anymore? Like, that was not an uncommon phrase. Do they even teach you this anymore? What have you been doing? Like, why don't you know this? God, I'm a very exuberant consultant right here. That's just my character, okay? Why don't you know this? But yeah, why don't you know this? And it's like, you can't really answer back. And if they ask me now, why don't you know this? I'd be like, well, you're a fucking consultant and you have been for 20 years, so get off my back, bitch. And I would just stand up for myself more. Maybe I wouldn't be that aggressive, but I would be like, it depends what I didn't know, okay? If it was something and you're like, oh fuck, why don't I know that? How many bags of fluids to give over 24 hours for, just the usual stuff, just to maintain hydration or fluid replacement or whatever, or what is a normal potassium, or what are the, I don't want to say stuff and people be like, oh my god, I don't know that, I don't know it, but we're all at different stages. You probably know stuff that I don't know, so yeah, I don't want people to be like freaking out because they don't know it, but it's like some of my surgical colleagues, they know more anatomy than I do, but then we've been doing different things, right? So I've been doing more emergency department stuff, more medical stuff. I have done lots of surgical stuff, but not like to the point of sitting down and learning the anatomy. I'm just like, well, I'll just turn up to work and I'll do some surgery and then I'll go. And yeah, so I can't even remember, like, I remember how I got here. I remember what I was talking about, but I don't remember how I got here. So teaching by humiliation is super, super common. I've taught medical students, and the issue is I'm now like thinking about it and I'm like, shit, was I like okay? Was I nice? No one complained about me, but is that the goal? I don't know. I'm not got any complaints today. Yay! No, but like, I don't know. I like to think I was nice. I hope so. So another one is sending students. I would say this one is not one that I've hugely come across, but sending students to see difficult patients. I was sent to see a really difficult patient once. I don't know if this was on purpose or by accident, but I was kind of like, why did you send me here? They sent me to like a really like personality disorder patient. I think I was in like 4th or 5th year, and I went in with like a piece, like a notepad, like, as students do because you don't want to write in the notes, and this patient was like, you're from fucking social services, aren't you? You're gonna take my child away. And I was like, no, I'm a student and I'm just trying to like write down, I'm just trying to write down and not write in the notes. She was like, get the fuck out of here, you bitch. And I was like, okay, bye. And that was scary, okay? Why did you send me to see that lady? I don't know. But maybe they didn't realise. I didn't get any vibes that anybody did that on purpose. And a lot of the time we say like, no, don't send the student to that patient. Sorry. But they are not a patient that should have students go to them. Either because they're confused or they're aggressive or they're really difficult and yes, students should learn to speak to difficult patients, but not if you're a first year, okay? You need the nice ones, the ones that are going to give you the information, the ones that can like, are just easy, okay? And I don't want that to sound like I'm being a bitch to first year medical students. Look, people, I've been there, okay? And it's scary. You're like, what do I think of next? Oh my god. Like, and you write down all of your questions that you're just not listening. So sending them to see difficult patients. Comparison. I don't know if this is a bullying technique, but technique like it's a fucking sport. Right, guys, now, so we're just going to move on to the comparison bullying technique, okay? So just line them up, tee up real nice, and then you're just going to look at them and go, you're not like the other F1s, like, you're not as good as them. Why are you shit? And then you're going to swing and hit. So it's not a sport. You don't have a technique to being a bully, but I don't know if I'm using the right words, but you know what I mean, okay? So comparison, I feel like audibly comparing students to each other, oh, they know more than you, and it's like, great, thanks, great. So it's not just students though, this has definitely happened as a doctor. It's like, oh, I had other F2s and they were like better than you. And it's like, yeah, but they might want to do like GP. Like, maybe I don't want to do GP. It's not my thing. I'm doing it because I kind of have to as an F2, right? Or, someone might be more surgically minded, and then someone who comes along and doesn't really like surgery, and then someone's like, oh, the one before you was way better. Like, they wanted surgery and they, stayed late, and it's like, that's not the fucking goal, mate. Like, get off my back. And I think also as a medical student, one of the common ones is not feeling included. You're not one of the doctors. You're not qualified. You're not, can you go into the doctor's med nurse, if you're not a doctor. And like, come on guys, we don't need none of that. And I do get it, like if there's loads of medical students in the mess and there's no room for the doctors who are paying to like sit down and like, you know, eat the food that they're buying or paying for, then, you know, people can get a bit shirty. But they're gonna be the doctors of the future, bitches. Like, make room, because if they don't come to your deanery, then, although most deanery spots are filled, but you want the happy and enthusiastic ones, right? Because bullying in healthcare is shit for everyone. Maybe apart from the person being bullied, but I don't know, maybe it comes back to bite them. But the thing is, it's shit for patients, like, and if we should care about anyone, it should be the patient. It's shit for the person who's working, and there's been obviously known higher rates of depression, anxiety, low self-esteem, and low confidence, and people are less likely. I'm just, you know, these are the reasons why bullying is shit. Like, I wasn't going to cover it because it's kind of obvious, but I think pertinently to healthcare is there are more sick days, and, you know, we don't need people off sick, you know, as short-staffed as it is, and it might make people more likely to drop out of medicine, and that's not good, is it? Like, that's sad. People have worked really hard and then they like the job, but people are bullying them, like, for sake. And number 3, people are less likely to, if they think something's wrong with a patient or, you know, incorrect with a situation, then they're less likely to seek help, especially if their consultant is the one bullying them. And I've been in situations where I've been like, fuck, I don't want to go talk to that consultant. And like, there are definitely consultants that I bloody love talking to, and I'm like, you, sir, ma'am, are the best thing in the world. Like, can we be friends? And there are definitely consultants where I'm like, I would rather not live on the same continent as you. So here we are, right? But we have to work together, and what I do then is I'll just save all the things up, and I'll just be like, here are all my things, and then run away, get the answer and run away. The thing is with students is they're easy targets. So that's my summary of medical students crying. Yeah, like I said, I don't think I ever cried, but I think there was definitely people who did cry, and it was mainly because the consultants were like, why the fuck don't you know this? That was shit. When you're like presenting a case, and it's like they just interrupt you every 5 seconds and make you feel like shit, and it's horrible. And obviously, like, if out of the 3 of you there, you might not have had the best like case, or you might not, you know, they're gonna pick on one person. I'm not sure if that person is the one who's done it the worst, or if they just get chosen. They're the chosen one, but they get chosen. And I don't know, like I said, I don't know if it's because like they don't know as much or something else. But I actually had a consultant once, I've just remembered, right? As a medical student, I had a consultant who was like, I'm got RF and you don't come back. And I was like, creepy? And it was also significantly creepier because this was like a sort of older man, and I was like, so I think I did tell the medical school about that. I was like, I found this really weird. Like, also, I was in, and he was like, you weren't in. And I was like, yes, I was. And that's when he said, I've got eyes in where I'm always watching. Like, those were the actual words. Like, I'm not even exaggerating. And I think at the end of the placement, I was like, this guy sounds like he's stalking me. And I found it quite creepy and intimidating as a, 20-year-old young female with a sort of 50, 60-year-old man saying, like, I know where you are at all times. And I was like, this is really weird. So, yeah, I don't know. Was that the right thing to do from my perspective? Well, fuck it, yeah, I don't care. So, as in, fuck it, yeah, I don't care right now. Like, I don't know what happened as a result. But I know a lot of consultants who either complained about, I'm laughing because it's just fucking crazy. Like, I just can't even, and there's one, I just can't even believe it. There's one in particular, one consultant who I'm thinking of, who, I think I was speaking to one of the other consultants at a different hospital, like a neighbouring hospital, like 5 years after being a medical student. And I was like, oh, what happened to this guy? Like, I remember when I was a medical student, everyone was complaining about him because he was being kind of racist. He was always like to the medical students, and I watched it, and it kind of started off as intrigue, but then a bit like people were offended, right? So he would be like, where are you from? And it would usually be like, an Asian, like, I don't know, female or whatever. I don't know if I just remember it with the person that I was with, right? So, where are you from? And they would be like, oh, I'm from London. They'd be like, no, where are you really from? And they'd be like, well, I was born in London. And you'd be like, no, but okay, where do you originate from? And then I'm not laughing at that, I'm laughing at what's to come. And then the person would be like, well, if you mean where, you know, where do my family come from, like what's my ethnic background, I don't know, Indian. And that's not like what they were, I don't know, but I just made up a random country. And then he got up, for example, India on the computer on Google Maps and would be like, here's India, where are you from? And then we would go through the map of India, and it's just fucking ridiculous. And then, like, but I couldn't tell if he was just intrigued or if he was kind of doing it to be a dick. Anyway, the funny part is later down the line, obviously this consultant gets lots of complaints, right? Because I don't think it was just that one instance. Anyway, he gets lots of complaints, and I speak to this other consultant like 5 years down the line. I was like, whatever happened to, I can't even remember his name now, whatever happened to, I don't know, Mr. Smith or Dr. Smith? And they were like, yeah, they weren't at the students anymore. And I was like, fair enough. Like, makes sense. So, and it was like kind of this known thing that he was a bit out there and a bit like rude, but like rude in a kind of like intrigued way. I don't know. It was like, I can't even describe it. It was like not like, ew, you're from blah blah blah, like gross. It was like, oh, so where are you from then? Oh yeah, no, I've been there. Like, did you grow up around here? And they'd be like, no, I'm from London, like I told you 3 times. And yeah, so I think they had a lot of complaints about being racist. So, and also sexist. I think it was in particular towards females, which, by the way, I'd like to point out that most medical students and now almost most doctors are female. So watch out and move out the way, men, okay? So I don't know if that's reverse sexism, but sorry if it is. Okay, as a doctor, I experienced I need to hurry up, I've got to be somewhere in like pretty soon. So as a doctor, I did experience one in particular. Like, obviously I've had some dicky consultants, but as a locum, you kind of just, you can move on, so that's quite nice. But also you recognize that, well, I'm not going to generally not going to form a relationship with you after working with you for one day. So, but what is nice about being a locum is that if you don't like a consultant or a ward or a specialty, bye, I'm leaving, never coming back. And I've kind of done that now. I'm like, I don't like ward work, so bye, not doing wards anymore. I hate ward rounds, hate ward rounds, like with a passion right now. They're my biggest enemy. So as a doctor, I had this nurse. She was actually a sister, and we were on the ward, and this honestly took me aback. Like, I was like, fuck, wow, you're a bitch. And she came on, and you know when you're just like so shocked that you're like, So she came in, and the thing is, on this specialty, the consultant was, I don't want to say controlling, but kind of controlling. He would write all the notes, he would prescribe all the medications. I was kind of just there to do the jobs after, right? I made no decisions, absolutely fucking none. And sometimes it's kind of nice, you know, you're just like, well, I'll just make no decisions today, I'll just walk around, get told what to do. Sometimes that's the kind of day that you want. But then the nurse comes up to me and is like, I think we should increase this, I don't know, bisoprolol. And I was like, it was a question about a medication, and I, as the ward bitch, did not feel comfortable because the consultant made all the decisions. And she was like, why is this medication this dose? And I was like, I don't know, the consultant increased it, or the consultant prescribed it. And she hadn't looked at the notes. I didn't remember, there was bloody 20 patients on the ward. I didn't remember exactly. And she's like, well, I'd hope that you would know about your own patients. And then just continue to like probe me about what I was going to do about it, but like in front of everyone. And it was savage. It was like being ripped apart by a fucking hyena pack. I was like, ugh! And it made me really uncomfortable. And do you know what? I was like, well, it's kind of my last day here in this whole hospital. I was just like, I don't give a fuck. Like, as in, not that I didn't give a fuck about the patient. I didn't give a fuck about the fact that she'd ripped me apart. And it was only that one time. And it was like, and then she just left. And I was like, that was really weird. Like, why did you feel the need to like savagely rip into me and then run away? Like, it made no sense. I don't know, her work there was done. Or, as I said earlier, maybe it's because I don't give off this like scared feeling. So she was like, oh, I didn't get the reaction I wanted, so I'm off. Right, come on, Dawn, we got to move on. Next, have I been a bully? Now, what I was talking about in the intro was interpretation versus intent. Now, I have had situations where there have been some kerfuffles, okay? And I don't see myself as a bully as such, but in my head, I'm like, I make jokes and I don't have any intent behind them. I'm not like, oh yeah, this is really gonna fucking rip them apart, right? They're gonna feel really shit about this. I make it as like a kind of, it's just my personality, and also, I don't know, maybe like a social banter thing. Now, sometimes it doesn't, in particular in one case, I don't think I'll go into it fully, but in particular it didn't go down well, and I would say in this situation I was bullied, but I was made out to be the bully, and it was like the whole situation was twisted onto me, so everything, they were all like gossiping behind my back, right? And then everything that I said was made out to be as if I was like evil and against them. And I was like, no, like that's not what I'm thinking. And then people were saying, well, it doesn't matter what your intent was, it's how it's interpreted. And I'm like, well, bloody hell, like I can't say anything then because it's how somebody interprets something. And honestly, after that, I left medicine. I was like, can't be fucked. Like, not can't be fucked. I hated medicine after that. I had a few months off. Like, the only reason I really went back was because of money. And I think if I didn't ever need money ever again, I don't think I would have gone back. Like, honestly, it really put me off that much. Now I've gone back and things are a bit better. A lot better, actually. I'm in a different hospital, and a different team. And that team in particular was like, so God, I'm gonna be late for this thing. I've got an acting session. I'm gonna be late. Hurry up, Dawn. Did I eat dinner? Yeah, I did. I haven't drunk anything. I've got a lot of energy today. Sometimes it happens, sometimes it doesn't. I like having energy. It's a good time. I think because I've been so productive today, I do this thing in the morning where I write down all of my negative thoughts. Like, it's called morning pages, and like everything that's just stopping me from doing things. And then I did it this morning and I was like, I'm on a fucking rampage. And I was like, I was off. Housework 101. It was Housework Central right here. So, yeah. So, have I gossiped? Yes, of course I have. Who hasn't? Have I hope I haven't talked about humiliation. I'm just going through the little sections now. Have I pressured people into doing things that they don't want to do? I don't think so. Often I'll be like, are you okay doing that? And I'm sorry, but if they don't answer then, like, I don't really know what else I'm going to do. Like, I've given them the opportunity to answer. I can't then do like a lie detector test on them. I think sometimes in medicine it can feel like, have I done enough? Have I done enough? And it's like, well, how much is enough? Do you know what I mean? Do you know? If I'm like, are you okay going and taking blood from that patient to one of the medical students? And if they're like, yeah, like I've given the opportunity, I can't then be like, I need to sit you down and interrogate you. Are you really okay with it? How okay with it are you out of 10? Like, you've got to take that as the answer, okay? Maybe you say, do you want me to come with you, or do you need any help finding stuff or something like that? So I hope that I haven't pressured people into doing things they don't want to do, or not don't want to do, because like I said, if someone said, do you want to go and do a PR, I'd be like, not really, but I will go and do it. It's not that I'm not qualified to do it. It's that, if you're giving me a choice, like, I'm not going to be like, yeah, I'll go do PR. My favourite thing. it's interesting because I think sometimes bullies, as going back to the previous, intent versus interpretation, sometimes bullies can make you out to be the bully, I feel, because they turn everybody against you. And it's very clever, it's very manipulative, and it's really damaging to your other social relationships. And it's like, oh, fuck. Like, and I've seen it happen to multiple people, like, not just me. If some, and I guess this is gossiping behind your back, right? And then and then everything that you say gets interpreted and you don't know anything about it because it's all happening behind your back. And then suddenly you say something and people react weirdly and you're like, oh, what happened there? Like I didn't realise I touched such a nerve. Like, what happened? So have I been a bully? Like, I don't know. Comment down below if I've bullied you. No, that was a joke. So no, I don't laugh at bullying. Like, seriously, I very much do not agree with it. And I was really sad when I learned that people thought that I thought things about them that I didn't. And that's because that was their interpretation and not my intent. And that is why I'm like, can you really bully people? Like, I think maybe you can if people interpret what you're doing as bullying, but I never intended it to be that way. So is it really bullying? I don't know. I guess it is. But then how do you avoid incorrect interpretation? Like, that's so bloody hard. Okay, come on. Got to move on to what to do if you're being bullied. I think bullying is generally, especially if they do that thing where they fucking get everybody against you, very hard to tackle on your own. Sorry, I just burped. So my main advice would be go up. I'm sorry, you don't want to be a stitch because snitches get stitches, but like they don't. Hopefully in medicine and maybe in prison, but not in medicine. But basically I've always seen it as the management. It comes from management, it comes from the senior, it comes from the consultant, whoever's like hierarchically like higher, and the sister of the ward, the matron, the manager, the consultant in charge. They are the gatekeeper. They're the one that says, no, this is not allowed. If you do it, if you bully, then, or if anybody feels like you're bullying, there's disciplinary action. And I tell you what, it's very hard to weed out in some subsections of the hospital. And some subsections of the hospital, it's almost not non-existent because they're so fucking lovely. But yeah, I always think like you need to talk to somebody senior. Obviously, try and resolve it with that person. But if you don't know that they're bitching about you behind your back, then it's kind of hard. But you can often sense that there's something wrong. Go to that person, try and resolve it, try and foster an open, honest, what's wrong? Like, what is going on? I'm sorry that you feel this way. And then see how things go from there. But I always think, don't be afraid to get the senior involved, and that's always what I've felt has worked better, because they are the one that can sit that person down and say, this behaviour is not acceptable. You saying it when they're bullying you doesn't really have any standing. Like, this behaviour is not acceptable, please stop. Like, that's just not gonna work, right? There's no consequence to that. And obviously, you can talk to them about it and see what happens. But I think there's a big thing with whistleblowers in the NHS. If somebody whistleblows, they not often, I don't know how I don't know the stats, okay, but they can get bullied after. Now, I've seen someone who's left a position because of that, and they've come to wherever I've worked, so I haven't seen them in that position. But I think, if the situation's that bad, there are other hospitals. There are plenty of other places who will want your expertise and who will want you. And I think, if you're an F1, talk to your educational or clinical supervisor. If it's them that's bullying you, talk to the foundation lead or someone you feel comfortable talking to. If it's the ward sister, talk to the consultant. Do you know what I mean? Talk to somebody who is kind of involved, but not like so involved that you talking to them is going to affect the situation. If you're a medical student, you can always put don't feel afraid. put in a complaint about a consultant, they're not going to get cut off straight away, but they might reevaluate their behaviour, and if they get like 10 complaints, then that's when, but then you kind of think, well, maybe you deserved it, you didn't fix your issue, you continued bullying people, so sorry, sounds like a you problem there, like go get therapy. No, sorry, that was mean. That was a joke. It was a joke. Yeah, so no, but actually it's kind of true, because it's like, well, if you're bullying people and you can't stop bullying people, like, please go and see somebody about it. Okay, if you're a consultant and someone's bullying you, I don't know, because who's bullying? The issue is with being a consultant is if a fellow consultant bullies you, number one, you're kind of at the same level, but they might be more senior or whatever. Number two, you're in a long-term post and you want to foster long-term relationships, and you've often, you're there for a long time, you're there for not forever, but it's not just as easy as being an F1 and just leaving because your 4-month post ended, or me being a locum and just going, yeah, bye. Like, if you're a consultant, it is much more hard. So I think, I don't know if any consultants are going to be listening to me, like, really? If you're a consultant listening, please say hello in the comments. Hi. Then I would just follow the same advice that I've already given, speak to the person. But then I think, if that person is continuing and you can't leave the post and, your life isn't like hugely miserable, then I do think like you can be amicable with somebody, you can be professional with them, but you don't need to spend time with them. Obviously it'd be nice to have friends at work, but you don't need to like go and hang out with them. You don't need to eat lunch with them. Just they're there, accept your differences and just keep on working. Okay, I feel like that's it. I've really got to go. Oh my god, I've only got 20 seconds to do the outro and I've probably missed the bus. So anyway, thanks so much for watching, guys. If you are watching on YouTube, please give it a like, subscribe, and if you're listening on the podcast and you can't see me, hello. I do have a video that comes out in a couple of weeks on YouTube, but it comes out almost the same day on my Patreon, Diaries of a Doctor 1. Bye! Ooh, that was tight.